why I went to Williams. And I was like, that was a real good break.
Good morning. In the past few months, the media has been bombarding us with information about the current Ebola outbreak in West Africa. There are some isolated cases that have been in the United States as well as other parts of the world. The Ebola virus is a serious health concern and should be discussed with the public to ensure safety. And as an individual training in a hospital facility currently, I think it is crucial to separate the facts from the myths in order to remain safe and provide the utmost in patient care and take care of all those that we are treating. Let's begin by starting to understand some of the myths that are circulating. The first is that Ebola is highly contagious. The second one is people believe that you can be infected by somebody who doesn't show any symptoms and they look perfectly healthy. Third, if you catch Ebola, then you're certainly going to die from the disease. Next, you can catch Ebola from touching general objects such as money. And the last one is my favorite, and that is that by intake of things such as condensed milk or onions can actually prevent the infection. Some of these myths are misleading and create a culture of panic. The best way to debunk these myths is to educate ourselves about the following facts about Ebola. First, what exactly is Ebola? Where is it endemic? What are the methods of transmission? What is your actual risk of acquiring Ebola? What are the symptoms? How are you diagnosed and treated? And how can we actually prevent infection? Let's start by discussing Ebola and where it began. Ebola actually refers to a collection of 5 viruses in the Filaviridae family that cause acute severe illness that is often fatal if left untreated. The virus itself is named after the Ebola River in the Democratic Republic of Congo, where the illness first appeared in 1976. This current outbreak is actually the most complex since its discovery in 1976. According to the textbook of microbiology, there have been very limited number of cases in the United States, and travel to endemic areas and caregivers of those affected individuals is very important. And again, according to our textbook of microbiology, the current outbreak has endemic countries with very weak healthcare systems, the lack of human infrastructure resources, and these areas have only recently emerged from long periods of conflict and instability. Next, let's discuss the modes of transmission and the risk of acquiring Ebola as outlined by the Centers for Disease Control. Infection occurs in humans. The virus can be spread to others through direct contact. That is through broken skin or mucous membranes being exposed to blood or body fluids. Body fluids being defined as urine, saliva, sweat, feces, vomit, breast milk, and semen. And those body fluids have to be from a person who is actually ill with Ebola. Also, contact with needles, syringes, and other objects contaminated with the virus. Direct contact with the body of a deceased person who is sick with Ebola. And there also have been cases linked to contact with fruit bats and primates. Next, let's talk about the transmission and risk, again, as outlined by the CDC. Ebola is actually not spread through the air, water, or food. There's no evidence that mosquitoes or other insects can transmit Ebola. According to the World Health Organization, healthcare providers caring for the Ebola patients, family, friends that are in close contact are at the highest risk of getting sick because of their contact with the blood and body fluids of sick individuals. During outbreaks of Ebola, the disease can spread quickly within healthcare settings, such as a clinic or a hospital, and exposure to Ebola can occur in healthcare settings where the hospital staff is not wearing appropriate personal protective equipment, which is what actually happened in one of the cases here in the United States. The healthcare workers were not aware that the individual had Ebola, and they weren't taking the proper precautions to protect themselves from infection. Another way of reducing the risk of spreading Ebola is to know the signs and symptoms. According to the World Health Organization, the early signs and symptoms of Ebola actually are very similar to the flu and can be confused. So, the symptoms of the Ebola actually are fever, severe headache, muscle pain, weakness, fatigue, diarrhea, vomiting, abdominal pain, and unexplained bleeding or bruising. These symptoms can appear anywhere between 2 and 21 days after exposure, but usually between 8 and 10 days. And again, that's according to the World Health Organization. Now, accurate diagnosis and treatment is crucial to prevent the spread of the illness and also limit the mortality rate. The early supportive care with rehydration symptomatic treatment also improves the survival rate. Those treatments include providing IV fluids along with balancing the electrolytes, maintaining oxygen status and blood pressure, and treating other infections if and when they occur. And again, that's according to the Centers for Disease Control and Prevention. According to the New England Journal of Medicine, there is no licensed treatment for proven to neutralize the virus, but there are a range of blood, immunologic, and drug therapies that are under development right now. Currently, they're using antigen capture ELISA testing, IgM ELISA, and PCR. Experimental vaccines and treatments are under development, but they've not yet been fully tested for safety or effectiveness. Recovery from Ebola depends on good supportive care and the patient's immune response. People who recover from the infection continue to maintain antibodies for up to 10 years. It's not proven if that prevents them from illness and reinfection from Ebola, or if they can be reinfected by additional strains of the virus. Some people who have been recovered from Ebola have developed long-term conditions such as joint and vision problems. The final component in understanding Ebola is knowing how to prevent infection. Community engagement is the key to successfully controlling outbreaks. Good outbreak control relies on interventions, especially case management, surveillance, and contact tracing of those individuals who may have been exposed, good laboratory service, and also safe burials and also social mobilization, which is currently happening in West Africa. Also, very important in preventing infection and the spread, dedicated medical equipment, preferably disposable items, should be used by healthcare personnel providing care. Proper cleaning and disposal of instruments such as needles and syringes are also important. Instruments that are not disposable need to be properly sterilized before being used again. Without the adequate sterilization of these instruments, virus transmission can occur and continue to amplify an outbreak. Healthcare workers who may be exposed to people with Ebola should follow the following steps. Wear the appropriate personal protective equipment, practice proper infection control and sterilization measures, isolate patients with Ebola from any of the other patients, and avoid direct contact with the bodies of people who have died from Ebola. Also, you need to notify health officials if you've had contact with the blood or body fluids, like we said before, like feces, saliva, urine, vomit, and semen. The virus can enter the body through broken skin or unprotected mucous membranes. Again, example, the eyes, nose, and the mouth. Now, if you are going to travel to an area that's been affected by Ebola, it's really important to make sure you do the following. Practice careful hygiene, including washing hands with soap and water or an alcohol-based hand sanitizer, and also continue to avoid contact with any blood or body fluids. Do not handle any items that may have come in contact with a person's blood or body fluid, including clothes, bedding, needles, or any kind of medical equipment. Avoid funeral or burial rituals and the handling of somebody who has died from Ebola. Avoid contact with bats and non-human primates or blood fluids, the raw meat prepared from these animals. Avoid facilities in West Africa where patients are being treated. The U.S. Embassy or consulate is often able to provide advice on those services. By understanding the risk and ways of preventing exposure of Ebola, the public can avoid panic and safely go on with their daily lives. In conclusion, Ebola is scary, but Americans have no reason to be afraid yet. Medical experts and government officials are hopeful that they can contain the situation in West Africa, and the scientists are continuing their work on a vaccine. As long as you're avoiding strangers' body fluids, you'll probably be fine. And if you want to scare yourself, read a pandemic novel. Thank you. Thank you so much for